So I'm in a challenge zone here because I have structurally papillary structures. I have nuclear, not papillary. And then I have other areas with the same kind of papillary structures, but I don't have the nuclear features. And notice I've also got some sort of active sort of now secretion or resorption of the colloid. Okay, so what's the mystery I have to solve here? A lot of needles, right? So they get fine needle aspiration. So I have to find out, did the patient have a needle aspiration? That's number one. Number two, if they have a lot of Hertel type cells, which they do here, very oxyphilic, those can cause some abnormal nuclear features. And the third thing is, besides Hashimoto's, you can also have Graves' disease, and patients get treated for their Graves' disease, which can cause these very large, very irregular, somewhat papillary structures.